Hello.
Okay. All right. Well, if that's the case, then I have information. I'm going to have a patient recording get in contact with you, and it will be more.
Hi, good morning. I'm Dr. Maxim Chumak. Most of my patients, and including me, call me Dr. Max. And this is another live session where I'll be able to answer any questions that you might have about. I cannot give a full consultation. Obviously, I need to see the patient in person, but I can answer some general questions about hair loss, some situations, give an advice that is, again, possible to deliver during this type of communication. Anyway, it takes about 10-15 minutes until most people get here and start asking questions actively. So let's talk about myself a little bit. Okay, I've been actively involved with hair restoration for over 15 years. So my clinic was here in Florida, was opened close to 9 years ago. In 90s, I was involved as a nurse practitioner in hair restoration, and was the older method, FUT, or what we call strip procedures. Now, about a year ago, we opened our new location. It's a beautiful spot right here, right next to the Atlantic Ocean in Fort Lauderdale, and we have a 2-story building, and it was designed to be specifically a hair restoration center with all the services that are being provided are tailored to get pretty much everything available to ensure success of either surgical or non-surgical options in hair restoration. About me, again, I'm hair restoration is my passion. I've been doing it for many years, and I'm always ready to learn things. One thing, being a hair restoration surgeon, you can never say, "Oh, I know to do, and I know everything, and I'm the best." This is wrong, because once you say something like this, you're not open to learning more, and it's always an opportunity to get more knowledge, more experience, and the goal is always to provide the best possible care to your patients. So please feel free to ask any questions as we go. Let's talk about my daily routine. So yesterday we had a big case, what we call a mega case, and on these days I don't have time to exercise, and because I have to wake up at 4 a.m. Our patient arrives at 5:30 to start with the third hyperbaric session before we actually take our patient to the operating room. And so on these days I wake up at 4, have to get here around 5:30, help with running the hyperbaric chamber before we get into the procedure. And obviously not much I can do as far as trying to exercise. Today, for example, it's a little bit easier day, no surgery, and I usually exercise about 30 to 40 minutes. At home, I have a system. It's an electronic system kind of on the wall that you can kind of follow your progress, and it's pretty quick and convenient to exercise. One thing about dieting, of course, we talk about hair. By the way, this year everyone talk about politics because this is the election year. We're not going to talk politics here. I think emotional and well-being is much more important. Okay, so politics, I think, it can hurt your feelings and cause too much stress, and stress, as we know, can cause some hair loss too. All right, so let's try to avoid stress as much as we can. By the way, I had a good friend of mine who his name is Mark Bishara, and recently we traveled to Morocco. I was presenting during the conference there, and he said, "Oh, I don't eat breakfast in the morning." And I'm like, "Why?" And to me, it was a mystery. So recently I read a book. It's called Young Forever. I think it was written by Mark Hyman. He's a physician who does a lot of regenerative medicine, anti-aging medicine, and there's a lot of very good points there, and it's all explained physiologically. I think it's more understandable to someone with a medical background, but anyone who reads this can learn very few good points. Okay, so it's called intermittent fasting. With intermittent fasting, we get our body responding to stress by actually using our resources to deal with that. And one of the things what happens, it's called, if I remember correctly, autophagy. So it's removing all the bad stuff that happens. So when you fast for about 14 hours, all this process is being activated. So again, I didn't ask Mark back then what was the reason skipping breakfast, but now I know. Okay, so I think 14 hours, it should be the time from dinner until you eat your breakfast. So you have a opportunity to push this mechanism of self-repair and autophagy. Okay, are there any questions so far? If not, we have some list of questions we obtained from popular forums, hair loss forums, and it's something I can start answering. Okay, by the way, we are live now on Facebook, Instagram, and YouTube. Okay, so some of the questions here. All right, what we receive. What is the difference between finasteride versus minoxidil? What are the benefits of each? Okay, so there's no really, it's not correct to compare finasteride versus minoxidil because both are completely different medications. The good thing about it that they are well-studied medications. Okay, so what that means is there are some medications that are still in the process of being determined whether it has some, how the efficacy, how the things are, with side effects. But minoxidil and finasteride are very well-known medications. Finasteride is a DHT blocker. What that means, it blocks the 5-alpha reductase enzyme, and it helps to decrease the damage that DHT, or dihydroxytestosterone, exert on hair follicles. Okay, so, and this is the main mechanism how finasteride works. Unlike minoxidil is completely different. Minoxidil initially was studied as a blood pressure medication given as a pill back in 70s and 80s to control hypertension. And then someone noticed, okay, or people who take this blood pressure medication, minoxidil, for some reason, their hair is improving. And they're, okay, it's probably worth to look what's causing that. And this is how they eventually came up with topical minoxidil, which obviously there's less systemic side effects, and it's been used as over-the-counter medication for many years already. Okay, so minoxidil works by the primary route of the primary pathway of action is vasodilation. It brings more blood flow to the treated area. If it's used topically, obviously. But there are some other weak anti-DHT properties. It does prolong, in many studies, it does prolong the anagen phase of hair follicle. Okay, so this is the difference. Anagen, that's what we want to see. Anagen, that's when the hair is thick, it's more noticeable, and normally anagen phase should last between 6 to 8 years. And obviously it can change with androgenic alopecia. Okay, any questions, comments so far? All right, so let's go to the next question. How do I know how many grafts I need for my hair transplant procedure? So very commonly asked question, and there's no exact number. Okay, so I would classify it as, first, what are the expectation? Okay, because density and expectation from surgery are different from one person to another. For example, if I'm looking to restore my anterior hairline, right, it has to match the rest of my hair. So if I have a thinning area in the back, obviously I can just match it, so the density should not be very high. If I have to match higher density areas, we need to obviously increase it to make it at least comparable, right? This is number one, so the patient expectation. Number two is what is the availability of the donor hair, right? Sometimes we need 8,000 grafts. That's just an example, right? But we have only 3,000 grafts. So we have to be strategic. We have to think how to utilize this limited donor area most efficiently. Number three is how coarse is the hair. So someone with a very thin hair obviously will need more grafts versus someone with a very coarse hair. I'm, for example, somewhere in the middle, but I've seen two polarities. I've seen people with very coarse hair, they will need less grafts. People with very thin hair will need more grafts. So it is determined during the consultation. For example, in my case, I do the trichoscopy, microanalysis with a microscope, and we can determine what, and then another factor is how big is the area, right? So someone with more advanced degree, Norwood scale, more advanced, we're talking about 5, 6, 7, will need more area to be covered. Someone with the smaller, 2 or 3, again, it's all proportional, right? The degree of the hair loss and all these factors will determine. So I hope it sort of gives a little bit of explanation. Next question is, okay, so here, question from Rosanna. How painful is the procedure? So procedure generally is not supposed to be painful, okay? This is why it is important to make sure that enough anesthesia is being administered, and whoever is doing anesthesia, they know what they're doing, okay? Because there are different methods of anesthesia. It could be a regional block, could be a ring block. could be a nerve block. Different areas can be treated differently, but the goal is always to make sure that the actual procedure manipulation, taking grafts, placing them, is completely painless. So to give an example, yesterday we had a big procedure, over 4,300 grafts. It was a long day, okay, and I always ask my patient, do you feel any pain? You have any discomfort? Okay, because even with occipital block in the back, after 3 or 4 hours, it's anesthesia start to slowly disappear. And at this time, I asked my patient, and more anesthetic was added to the area, so my patient is always comfortable. Okay, hope that answers questions. Okay, let me check here. Are there any comments? Okay, how long is the mixing? How long is the healing process? A question from Olar. Okay, so healing process is really depends on how first. Okay, so each person is different. We have different physiology. We have different genetics and a lot of things that we do and what happens to us health-wise depends on who we are. Okay, some people will heal faster, it takes longer. So I would say in average, healing process should not take more than 3 to 5 days for the donor area. Recipient area, visually, maybe a week or two, scabs will appear and they slowly clear. What I learned recently, okay, and that utilizing hyperbaric oxygen therapy during the actual surgery does facilitate recovery much faster. Okay, so when I compare with cases that I did before having hyperbaric chamber on premises like we do now, and we do have what we call the hospital grade hard shell hyperbaric chamber. It's very there is a again I will go into this a little bit later, but basically there are mild and there are hospital grade chambers. So the chamber that is capable of 3 atmosphere makes a big difference because healing is faster, graft survivability is much higher, overall patient experience because it doesn't reduce inflammation, postoperative recovery, pain, graft survival, everything. So we usually see at least twice faster recovery with hyperbaric chamber. But otherwise, it takes about 2 weeks for the scab to disappear on average, and 3 to 5 days for the donor area to heal completely. Okay, so another question from Boyd Medicine. Okay, so what was my biggest case? So again, I'm a strong believer that only hair restoration surgeon should perform the entire procedure. Okay, so in order to put things into perspective, there are 2 approaches how we deal with hair restoration surgery. One, you have a physician take a supervisory role and controlling the flow. Okay, so physician does anesthesia, inject anesthesia, does medication administration, hairline design, these kind of things. Okay, and then he or she delegates everything else to technicians who are usually unlicensed because there is no license for technician in hair restoration, at least in the United States. I took a completely different approach. I do the entire procedure with my own hands from the beginning till the end. So I don't leave patient side, never. So I start harvesting and I do implantation of every graft by myself. So obviously this has some limitations. This is how many grafts I can do. The good thing, we are over years doing the same approach, we became very efficient. For example, yesterday we finished 4,360 grafts, almost 4,400 grafts, implantation from 3, and we were done before 7 p.m. So our average speed was about 1,200 per hour, which is very good, okay? And the question is, how many? Yes, the biggest case I did was 4,500 grafts. But again, it was done everything in the control by myself. And I think this probably should be the most you should do in one day. It always depends what's available. Okay, some people do not have this many grafts to be harvested, even on 2 occasions. So there's a lot of factors like previous surgeries, how big is the donor area, and so on. I don't want to go into too many details, but this is generally. So 4,500 grafts, that's the biggest case I did. Yesterday it was close to 4,400 grafts. A lot of things happening, ergonomics is important, and good overall fitness. So I try to exercise as much as I can. If I was weak and my stamina was not as good, I wouldn't be able to do these long cases. Okay, so another question from Boyd. Can anyone use the chamber? Yes. So there are only 2 contraindications. That absolute contraindication is history of previous pneumothoraces, which is a very rare condition, right? Inability to equalize, and certain cancer treatments, which is also not very common. Hyperbaric chamber is very safe. It gives you 100% oxygen at 2.5 atmosphere or 2.7 atmosphere, depends on what condition we are treating. And hyperbaric chamber provides up to 800% more oxygen to every single cell in your body. So it saturates with antioxidant activity. It helps to facilitate regenerative processes, wound healing, help with back pain. There's so many indications. There are, I believe, 17 FDA-approved indications, and there are probably close to 100 still, not officially FDA endorsed, but there's a lot of studies on PubMed that you can read. It's very powerful anti-aging treatment. Actually, the only treatment that actually proven in vivo to elongate telomeres. Telomeres are responsible for our longevity. Okay, telomeres, it's there's end caps on the chromosome. The thinner they are, the closer the cell to the apoptosis, to the programmed cell death. So HBOT, or hyperbaric oxygen therapy, is proven to elongate telomeres. And you can search it by yourself on PubMed or NCBI websites. Okay, let me check if there are any more questions. It's nothing on YouTube yet. Okay, so another question from Boyd: is hyperbaric good for rejuvenation? As I mentioned before, good anti-aging treatment. So, hope it answer. I saw a video on YouTube where you talk about your surgery and you use the hyperbaric. How does it help after surgery? I think I already mentioned that. So there's main modes or mechanisms of action of specifically post-surgically. So what happens after grafts are being taken from one area to another, right? Imagine we take a live tissue one by one, let's say 2,000 grafts, right? At the meantime, before we're ready to reimplant them, they are staying on this little petri dishes in a chilled environment, about 8 degrees Celsius. But they are devoid of oxygen. There is no blood flow, there is no blood outflow, so there's no way to deliver oxygen, there is no way to take the CO2 out, and this is how the live cells function, right? So it consumes oxygen, there is a mechanism called the electron chain, how it's being converted through ATP, and then the CO2 is what excreted. So for a couple hours, 2 or 3 hours before they're ready to be reimplanted, they accumulate all these byproducts of metabolism. And byproduct metabolism include lactate and other things that we don't want to have inside the cell, all right? So when we finally place them into the area, the flow is somewhat restored, but we call it the phenomenon IR, ischemia reperfusion injury. This is the same mechanism after organ transplantation. When we take a kidney from one person and transplant to another person, there is discontinuation of blood flow and then restoration of the blood flow. So ischemia reperfusion injury can hurt cells, and this is one of the reasons some transplant will not do well. So it is proven that oxygen therapy, when done correctly in the proper chamber, can reduce this ischemia reperfusion injury. And this is my main explanation why I like to use it. And we use it during actual surgery. So we start with hyperbaric chamber before, and we end with hyperbaric chamber right after we finish the surgery. So the only downside, it does prolong the entire time, so by almost 4 hours. Like yesterday, we started our surgery at, I believe, 8 a.m. It was a long case. We finished around 6:15 p.m. And then patient went to hyperbaric chamber for another hour and a half or so. So again, but it's a big investment and big procedure. So I think it's important to take every measure to ensure success of the procedure. Okay. Any questions here? All right. So I'll go ahead and read the next one from. Okay, what is a trichologist? That's one of the questions of the forum. So, trichology, it's someone with some type of training that probably entails hair, physiology, and other things, okay? The problem that we do have, so when trichologist is a physician, we know it's a medically trained, licensed person who can provide medical advice and care. So trichology, there is no board of trichology, there is no licensing body of trichology, so it's mostly a self-proclaimed position. So someone who thinks he or she is proficient in science of hair physiology and treatment, they can self-proclaim, I'm a trained trichologist, okay? But I think it's very difficult to have a quality assurance here because there is no licensing authority that can license this particular person and know that her or his knowledge is up to a standard, okay? Unlike the physician, we do have a board of hair restoration surgery, so we have to take training, we have to be so many years in practice, we have to take oral and written exams to pass, and it's being evaluated objectively. And then you get a designation as a diplomat of American Board of Hair Restoration Surgery. So this is the difference, okay? And obviously before you can become a diplomat, you have to finish your medical school and residency training and so on. So this is the difference. Okay. Next question is, what can women do to treat their hair loss besides of hair transplant? So with women hair loss, hair transplant is not the first choice and not the second choice, okay? It's probably not the third choice. So women hair loss is much more complicated than men. Okay, in men, statistically, androgenic alopecia number one cause of the hair loss. In women, it's not. So treating with hair transplant female causes of the hair loss is wrong. Okay, I'm talking about these are not amendable to surgery. Okay, so in hair loss in women, first it requires a medical examination. There are a lot of causes like anemia, thyroid deficiency, PCOS, polycystic ovarian syndrome, scarring alopecias. That's a big thing because if someone may not being diagnosed correctly with scarring alopecia and underwent hair transplant, it's not only will destroy all these grafts because they will not grow or they will disappear in the near future, but it's also it's a waste in time because proper diagnosis is essential to preserve hair follicles alive, right? In case of lichen planopilaris, in case of scarring alopecias, like very common in African American women is CCCA, centrifugal cicatricial alopecias, they need to be treated on time and to preserve these hair follicles alive. So if you are experience hair loss as a woman, please do get an appointment with dermatologist, hair transplant surgeon, or someone to get evaluated correctly. Okay, don't go to Turkey because if you go there, they will take you, they will do your transplant. But if you're not a candidate, that you will waste your money and you will waste your time. So please please be smart. Get evaluated by a qualified professional as a woman before deciding on hair transplant. Okay, next question. Okay, how long does it take to see the results of hair transplant? So typically we talk about 6 months to 12 months to see majority result. You don't see much before 6 months because first, hair need to adapt, sort of recover after with stress being induced during hair transplantation, but then it needs to grow long enough so you can see it to the naked eye. So typically what we do after transplant, we have a follow-up regimen, 3 months, 6 months, 9 and 12. At 3 months, we just do microscopic evaluation with trichoscopy. We check how the progress go, but most of the time we start seeing growth between 5 to 6 months. Everything is actually changing now with hyperbaric oxygen therapy. Again, I've been talking about that previously. And with HBOT, we actually see more and more hair follicles growing much faster, not going into the shedding phase first, but continue to with the growth, just like nothing happened. And this very interesting phenomenon is something that I'm trying to create an environment to make it more universal because it can make a big difference. For example, in case of no-shave hair restoration, right? It would be nice. You get your no-shave surgery, you take the long hair from the back, you place it in the front, and it continued to grow like nothing happened. You have to wait for 9 months to see the results. So there are things that I'm working now to enhance this phenomenon, and we'll see what happens. Okay, next question. What are the advantages and disadvantages of those who fly to other countries for this procedure, mainly Turkey? Okay, so one problem what I see as a surgeon who personally does the entire procedure from beginning till the end, that recently hair restoration became like a commodity. What that means, people treat it as going and buying a TV. Okay, so let's say I want to have a latest model of Samsung TV. I search Best Buy, Amazon, and the Walmart website. Oh, here's the good deal. I'm gonna go there because it's the same model of Samsung. So okay, doesn't really matter if I get it cheaper, right? Hair transplant is absolutely not equal thing anywhere you go. Okay, hair transplant is not a commodity that you can just find the best deal. At least if you value yourself, right? And choose what's the cheapest, right? I mean, if you have a heart problem, are you gonna search Google who is the cheapest heart surgeon and go to the cheapest heart surgeon? Probably not, okay? So something that on the top of your head clearly visible should not be treated like that as well, okay? So it's not a commodity. It's very important to research, not just seeing pictures. You know, with this artificial intelligence, right, that we have, we can create any pictures, we can create any videos, we can create any alternative reality to try to believe. And these guys over there, they have unlimited resources, okay? They pay $3 per hour, I don't know, just an assumption, okay? But it's much lower salary. So, you know, they can create any alternative reality that is believable to you, okay? And they, if they post real pictures, which they a lot, you know, if they do 70 procedures a day, in some clinics they do 70 surgeries per day with 1 or 2 doctors available for the 70 patients. You can imagine how much a level of doctor involvement in your procedure is, okay? And you can get good cases, absolutely. But always ask yourself a question. Are any of these clinic will post any bad pictures? Logically. And I can tell you, very likely, they will not post any bad pictures. And what we see here in the US, okay, we see people who are not treated to a standard. We see a lot. And we have, in ISHRS, we have Fight the Fight campaign, and where we try to help people who had botched cases elsewhere to, and we call it Repair Day in November, and you can research. If you're one of these people who had bad surgery, please reach out. There are doctors that do, and including me, once a year we identify a patient who does need help, and most of the time it's either done for free or it's done or significantly discounted. But again, this is very, very important. Pictures and now videos are not the determining factor where you want to have your procedure. Okay, I hope it clarifies things. Okay, let me check the next one. Okay, yeah. So another question from Hadi: What if I got bad transplant results in another country? Can I come to a clinic to fix it? Yes. Yeah. So again, consultation. That's the good starting point, and we can see what can be done. Okay, a lot of times we can fix the hairline. There's a lot of different things that can go wrong when you had procedure not by a qualified person. Okay, it could be wrong hairline, wrong shape, wrong hair being used. It's too low, a poor survival rate, too much scars. Again, there's a lot of things. Recently, I had a patient who came in from Turkey, and he had ischemia or necrosis of the entire frontal area. And this is with infection introduced. He was treated for MRSA. He was treated by hyperbaric chamber for ischemia, necrosis, that area, because during implantation they damaged blood vessels, and it resulted in we were able to help it, but again, it will require more procedures to fix it. I started having problem with hair after COVID. Could COVID affect my hair? So, no clear indication that COVID by itself could affect or could cause more hair loss, but any acute illness, any illness that causes a lot of stress on our body, it could be COVID, it could be flu, could be pregnancy, could be anything that induces stress and results in cortisol release, can trigger hair loss. Okay, so there are some case reports that COVID actually was triggered some autoimmune condition like lichen planopilaris or vaccinations. Again, it's not confirmed. It's more, I treat it more like a speculation, but sometimes something conclusive will be derived later from these claims. So, but to answer the question, yes, COVID is a stress, and it can be dealt with PRP, minoxidil, Finasteride medications if it's a male, of course. Okay. Another question from Anna: does rosemary oil work for hair loss? So, good question. Okay, so it could. Okay, question is, what is rosemary oil? And I've been asked a lot of time about different herbal medicine. Okay, so generally, some claims of herbal medications can help with the causes of the hair loss. Maybe valid. My response always the same. Rosemary oil from China versus rosemary oil from Holland versus rosemary oil from Costa Rica, for example, are not the same. Okay, they've been grown in a different environment. They will have different pharmacological action, concentration, the way they were prepared, they were a little squeezed. There's a lot of factors that we have no control, and we have no idea until we actually try and doing something to us, and then wait and it takes quite a few months, 5 to 6 months, to see whether it works. So I think it's a big risk, because all these factors that we cannot control, where this herbal supplement was coming from, how it was prepared, there's no quality assurance that we can determine here. And I think pharmaceutical approach is more reliable, because we know the concentration of the active ingredient, that we know track record of each medication, we know what we're treating. So and think putting oil on your hair, it's not very convenient too, right? Think about it, it's gonna look greasy and you cannot really remove it. So again, you can try, but my advice is probably rely more on the pharmaceutical ingredients. Okay, Stephanie. Okay, I don't think it's a real question. So Hadiz asks, how can I get a consultation with you? So yeah, you can, consultation you can get on our website, main page, or pretty much every page has a consultation form. You can complete it. You can schedule your own consultation by going to consultation page, and you have a time already, and you can do it yourself, and we just get notification. You can call us and talk to anyone here in the office, and they'll be happy to schedule. Okay, next question. What is PRP and how can it help my hair? So what is PRP? PRP is platelet-rich plasma. It's been probably discussed in so many live streams and videos, and but okay, basically what, and I'll just try to be as brief as possible. So PRP stands for concentrated thrombocytes, or platelets. They are, in our organism, are responsible for repair mechanisms. So platelets are little cells that can stop the bleeding. And at the same time, they release growth factors that bring the cascade of events and induce regeneration. Okay, that's how if I cut myself here, right? The first response of the organism is to recruit platelets. They concentrate there. They start with growth factor release and induction of thrombosis, it's pretty complex process. But and someone mentioned, seen many years ago, okay, why instead of actually inducing the injury to our skin, face, hair, we can get platelets, concentrate them enough, activate it somehow. We can activate it with cold, we can activate it with calcium, or other ingredients, and then inject it. So this is how PRP works. We take it, we collect blood, we have a special device, centrifuge, we extract all the platelets, and we get about 20 times more concentration of platelets. We have a way to check the concentration. We have on-site CBC analyzer, so every sample we check for quality, so we know it is what it is, PRP, and not just a yellow-colored fluid. And then we inject it into the scalp with a special automatic injector to help with regenerative and to propel hair regenerative mechanisms. Okay. Okay, so what supplements do you suggest? So supplements are important, okay, when you're missing something, okay? So usually when you are on the balanced diet, you have vitamins that will be checked normal, and biotin might be helpful, but I think it's overall making sure you're in good shape, right? As we get older, it becomes more difficult. I would say if you are physically fit, okay, this is number one. By the way, reading this recent book, Young Forever, Dr. Mark Hyman, by the way, highly recommend it. I have no interest financial in this book, but I think it's well explained what you need to do, especially once you get 40 plus and beyond. So you what you can do is limit glucose and starch. This will decrease your all-case mortality, according to this book, by 70%. Just these two things: less sugar and less starch. Then number 3, physical fitness. If you have no sarcopenia or muscle atrophy, you feel better, you deal with stress easier, less cortisol release, less reasons for hair loss. So only these 3 things, glucose or sugar, starch, and physical fitness, will help to address a lot of things. Everything else, okay, you can take multivitamins, supplements. I don't think it's going to be very effective, but if it makes you feel good, that's probably fine. Okay. Oh, what other books do you read? Question. Okay, so I listen to books. I have a busy lifestyle, and one thing what I do during surgeries, and I tell my patients, because what I do is very it's very redundant. Placing grafts, like yesterday, for example, I had to harvest 4,300 grafts one by one from here. Okay, we use partially robot. I harvested 2,100 grafts using Artas robotics, and then the rest manually from the sites. I like to use manual extraction from sites and from the inferior portion of the donor area. But implantation had to sit for 4 hours. So I listened to books, and I like history books, and Recently, I finished Josephus Flavius historical, and actually have the whole list. Probably last year, this way I was able to finish close to 300 books. So one thing is specific for being a hair transplant surgeon. I have to sit in this position for 8 hours straight during procedures, during big surgeries. Okay, so what the next one? Let me see. Are we almost? Okay, 9 more minutes. So we'll make it 1 hour for this live stream. And let me go and check more questions. Oh, how can you tell if someone's hairline is unnatural? Okay, so first, unnatural hairline could be due to hair loss, right? This is the most common reason why people come and seek help, because they feel my hairline, since I was 20 years old, it looks different, looks unnatural, and as it will be easier, we probably will have one of the podcasts. We will talk about what makes hairline natural. So looking at my hairline here, right? My hairline is not completely natural because I have a little bit of thinning here, and I'm okay with that. And my thinning, thanks to using the topical solution, did not get worse over the last 10 years. So I have a way to track it, look at my pictures from 10 years ago. But there are two things. So this is the anterior portion here, this is the anterior hairline, and the peak and the lowest should correlate with the mid-glabellar line right here. Okay, so the hairline, I'm talking about the man hairline, right? This is the mid-pupillary line, and the widest portion of the hairline is supposed to correlate on both sides symmetrically. And then when we're talking about frontotemporal angle, is the part where your temple hair connects with the frontal hairline here, and we call it frontotemporal angle. So this frontotemporal angle, if you try to slice it like on the CAT scan, is supposed to correlate with the lateral canthus of the eye right here. It is what makes look natural. When we talk about hair restoration, we got 5 more minutes. Presence of micro and macro irregularities is essential to make it look natural. For example, a lot of time I see people coming back from overseas clinics again when doctor's aesthetic touch is not being used, right? So they have this big chunky grafts in a straight line, starts very low from here and they go across. Okay, so if someone like this walking and he's screaming, I had a hair transplant, and I had a pretty bad hair transplant because they did not make it look natural. Okay, so when I planned the procedure, and here in Hyperbar Dr. Max we have classes for doctors interested in starting hair restoration as a profession. So this is what I teach. Okay, so my goal with the hairline is someone like me with lots of years of experience in hair restoration. If I see you walking down the street, I won't be able to tell you had a hair transplant. This is how it's supposed to look. It's supposed to have micro, macro irregularities to make it completely random, right? It's supposed to follow the shape I just discussed overall, and has to have a transition zone where all the irregularities, and I use a special hair, use a selective hair harvested to have this finer, thinner hair follicles to comprise that hairline. So there's a lot of things. It takes time and to create a natural hairline, but this is kind of a main thing. So okay, we have what, 4 more minutes before we finish. Okay. Let me see supplements. No questions there. Okay, next question. How young can someone get a hair transplant? There's not good straight answer here. Okay, it's more determined by a hair transplant, hair restoration doctor. So some doctors will tell, no matter what, if you are 25 years or younger, you don't get a hair transplant. The problem is, at this point, if somebody really wants to get a hair transplant, what they're gonna do? They're gonna go to a different doctor and get it. But here's my approach. Generally, I don't like to do hair transplant on very young people. Okay, and why? Because we don't know how far hair transplant, hair loss will progress in the future. And if someone is 17 years old, 18 years old with advanced hair loss, and you know that most likely this person will end up with at least Norwood 7. So anytime hair loss is more progressive, it steals from the donor area in the back. The further back the area of the hair loss progresses, the less donor area is available. So the problem here, okay, if that young person is very much affected by the fact of the hair loss, it could be devastating emotionally for a young boy, not being able to feel secure, walking, to find a meaningful relationship. I make an exception. If that person, even being young, 18, 19 years old, is devastated, and our goal is to help to feel better, because he needs to go to college. He needs to feel like he is accepted and not being judged because of the advanced hair loss. So in this case, I talk first. I'm trying to determine whether he is able to make sure he's going to be able to take pharmacological therapy after. That's number one, because it's absolutely essential. Taking finasteride, minoxidil, even after surgery, pretty much as long as hair is important to him. If he does commit, this is one check for number two. I tell that person that I'm not going to be very aggressive. I'm not going to be aggressive at all with creating a hairline. And then the hairline that I create, if he wants to be treated by me, it will be super conservative, as high as possible, to preserve the donor area for as long as possible. If he agrees with that, I can tell, okay, and everyone on the same on the same board here, then we're gonna move ahead and schedule the hair transplant. So now now we're 11:59. I hope it was somewhat informative for you. We're gonna try to schedule live sessions more. You can always ask questions just by contacting us. We have a system. Anytime you text us, it goes through the pipeline, and if our patient care coordinator can answer most of the questions. If something she doesn't know, she asks me, and I will respond to that. So please make sure that you can talk to us when you need it. Thank you. Thank you so much for being with me for this last hour, and we'll talk soon.